Hi, this video is how to be a smart patient. Basically, a hospital is kind of like a small town. There's a way it runs, and there's a way to behave and act and use a hospital or a clinic to get the most value for your time, your money. First thing I would say is dress nice. Don't ask me why. I'm just telling you, I've been a doctor 30 years. If you dress nice, things go better for you in a hospital. I've had to go plenty of times to the hospital to help take care of my parents. And I just know from experience, I wouldn't walk into a hospital unless I had a shirt with a tie on. You just get treated with a little bit more respect from the nurses, and they're more likely to. It's just better. It just is. Hospitals are kind of hierarchical. Be very nice and polite to everyone. If the nurse likes you, she'll be more likely to help you and just do little things that'll make your life better and your family members' life better. It's just the way it is. Family member should always be in the room of an inpatient. So if somebody's in the hospital, like my father went for open heart surgery, I slept in the ICU room with him and the regular room with him. You always want to do that. And if they try to say you can't do that, go over their head. Like if the nurse tries to block you, go to the doctor. You want to be in the room with the family member, especially if it's an older person, maybe English isn't their first language, or maybe they're confused. It just helps having a family member there. Just, stay out of the way of the nurses, but it helps. All kinds of little things might happen. Does a tube inadvertently get pulled out? Do they have a problem at night? Are they tangled in the sheets, the lines? Whatever it is, it's good to have a family member in the room whenever possible. In general, I prefer doctors to be over 45 years of age. They just got a lot more experience. The young ones tend to be more based on guidelines. A good doctor keeps improving with age, so they'll be more likely. For example, you go to a pediatrician. If the pediatrician's, 35, they're less likely to have their own kids. By the time they're 45, 50, they're more likely to have raised their own kids and have that experience for what that's worth. And the same thing carries over to a lot of other areas. They just can predict things a little bit better. It's not a guarantee, but it increases the odds of an optimal result. Don't do any tests unless you're ready for the follow-up. Once you step up to a screening test or an imaging test or certain types of lab values, there might be very serious consequences for that follow-up. For example, prostate-specific antigen is often used to get a sense of the risk of having prostate cancer. My approach to PSA testing, prostate-specific antigen, is I don't want to do it. I don't want to know that. What I do is I diminish my risk of having prostate cancer by lowering all the estrogens, so my pretest probability is so low that it would be a waste of time to check PSA, because you'd be much more likely to get a false positive than to obtain any useful result. When the pretest probability is low, then false positives are more common than true positives. So the test is a waste of your time, and you don't want to risk the morbidity, the side effects of getting, that big needle up the rectum for a sextant prostate biopsy, 6 specimens, like let's say, 18 gauge core these days. You could potentially, have side effects, impaired erectile function from that. So keep your risk low is the smartest thing. Low sodium vegans have very low risk. And if they avoid estrogenics, you have a low risk of prostate cancer. In general, for any type of screening test, if you have a higher risk, then it's more reasonable. Like anybody who eats a westernized diet, you should get your cholesterol checked. You need to know that. That'll help guide you to understanding what your risks are. If you have to go for a procedure, whatever it is, it could be colonoscopy, it could be a surgery. In general, the best time to get anything done is Monday morning, and you want to be first case if possible. The reason is, let's say you went out of your way to get the best possible doctor to do your surgery, your colonoscopy, whatever. Well, that doc probably has a day off on Saturday, and the person checking on you is going to be a junior resident. If you go on Monday, that attending physician, the expert, will be there most likely on Tuesday, Wednesday, Thursday, Friday. So if you have any post-operative, post-procedural complications, you'll get the most experienced person to help manage them. If I'm going for a procedure where they have to sterilize the device, like a colonoscopy or something, I want to be first case Monday. Let that thing sit in the sterilization solution over the weekend rather than just overnight. Does it really matter? I'm not sure, but it makes me feel better to do it that way. Don't get sedated if you don't need to. A lot of people, the first thing they say, I just want to be knocked out for this. Well, I think that's, kind of ignorant. And the reason I say that is you might have some side effects from the sedation. Sometimes the sedation is more dangerous than the procedure. I had a colonoscopy many years ago. I didn't get sedated for it. I got teased about that a little bit, but it went fine. I then was mentally sharp the whole rest of the day. I don't want any of these medications that impair my memory. What if they have a prolonged effect? Ask the surgeon when he has the best techs and nurses. I did a fellowship in imaging guided surgery, also called interventional radiology. I've done like about, I don't know, many thousands of procedures. And I can tell you, if it is, most procedures are easy, but sometimes you get a difficult case or a complex case, a complex procedure. And in that setting, it helps a lot to have the best technologists and nurses working in the room. And the surgeon knows when he's got the best staff with him. Like if I had to do a cerebral arteriogram, I know if I have the tech that's really good with cerebral arteriograms, everything's going to be faster and easier. And that matters. There's lower risk of a complication in that setting. Okay, I got to go to the next slide here. Okay, another thing is to get the best outcomes from surgery, the patients who do best are the ones who get moving very fast. There's a guy by the name of Maxwell Maltz. He was a plastic surgeon. He's got some videos online. He's an old guy, but he has some black and white videos from probably the 1960s or something online. He wrote a great book called Psychocybernetics. By psychocybernetics, what he meant was psycho being the mind, cybernetics being to steer, like to steer a boat. I think that's a Greek word or something. And it was actually a great book. I knew some national champion, world champion athletes in the 1980s, and they used to love to read Maxwell Maltz. He'd get you psyched up. And what the thing about Maxwell Maltz was, he had noticed his plastic surgery patients, you could have two patients that seemed pretty much the same in terms of all their physical, medical issues, and one would get a great outcome, the other one would have a lousy outcome. And he started to notice that it really depended a lot on their personality. Personality is much more important than people realize for all kinds of things, for academic performance and for surgical outcomes. So the point was a patient who was highly motivated. I have to get the surgery done, then I have to get home to take care of my kids, or because I got to do some big event or something. Those patients would do great. But if the patient was all kind of moody and sort of confused about what their goals were, they often would have a suboptimal result. And I'm just going to give you one example. My aunt was a family practice physician herself. She was 78 years old, still practicing medicine. She fell and got a hip fracture. On the first day post-operative, she requested to leave the hospital to sign out AMA, against medical advice. She and then the nurse said to her, "Aren't you in a lot of pain? I mean, don't you want to stay?" She said, "Nope, I'm not worried about the pain. I can handle that. I'm afraid that if I sit around in bed, I'll end up with a pneumonia, or I'll get a DVT, deep vein thrombosis in my leg, and potentially a pulmonary embolism." So, she's a very strong woman, my aunt. She had graduated first in her med school class, and she was sort of a real hothead, tough lady, and so she just wanted out of there. I also have a friend who was a general surgeon, vascular surgeon, and he ended up going for open heart surgery. Just to give you perspective, he was in his 60s at that time. And he also left on the first post-operative day. He said, "I'd like to go home. I can take care of myself." And also, these are people who have good support systems, okay? They've got family members who know what to do to take care of them, are available, etc. So I'm not saying regular person should do this. Of course not. Most people couldn't do this. They psychologically didn't understand the process well enough. But I know from experience, these experienced physicians, when they have had to have surgery, they want to get home as fast as they can. Minimize pain meds. I mean, sometimes you need pain meds. You're in too much pain, but be careful with pain meds. I know from experience, I did a surgical internship. The patients who sit around keep asking for pain meds, a lot of times they sit in bed. The pain meds sometimes cause constipation. They're more at risk to get blood clots in their leg. They're more at risk to get pneumonias. You want to be up and moving as fast as you can and try to get back to your normal routine as soon as you can. So, having a clear understanding of what to expect, what you can do, that all helps for getting the best results. For general conditions, these are, of course, we're talking about a lot of different things here simultaneously, but whatever disease you have or problem you have, try to learn about it. Read about it, watch videos about it. If you have a chronic disease, it can often be helpful to read books about it. I will read whatever book I can find on a disease if I'm concerned about it. Books written by patients, a lot of times they're kind of clueless and crazy, but sometimes they're great. Some patients have written great books about their disease, and I've really learned a lot from them. So you never know what you're getting into. Check it out. They give you ideas. Because the best thing for any disease is if you can figure out what causes it, you can avoid the cause, and that often provides the best possible outcome. What else? Try to get informal opinions. I always ask doctors, I'm lucky, I know a lot of doctors, and I'll just ask them, what would you do if you had this? I'll get an informal opinion. Once you're in a doctor's office in a formal visit and you've been referred by someone else, that doctor has obligations. To some extent, he's obligated to make sure he pleases the referral service doctor. There might be obligations for whatever condition you present to the doctor with to follow certain guidelines. So little things you can do. You can ask the doctor, what would you do if you had this yourself? That frees them up a little bit to tell you what they would do. And the other thing too is the doctor always assumes the patient might be cognitively impaired, because tons of patients are cognitively impaired. So they're usually going to try to keep things simple, be very professional and polite, and talk kind of slow and stuff. So what I'm trying to say is, when you show the patient, you already know, you show the physician, the nurse practitioner, whoever you're seeing, that you know something about your disease, you're familiar with the terminology, the jargon, you'll be able to discuss it in more detail. So that's why I'm saying you want to be prepared for your visit if you can. Of course, it depends on the situation, but the better informed the patient, the more likely to get an optimal outcome. You don't want average outcomes. Of course, that's what one often might end up with, but you want the best possible outcome. Do not assume everything is easy. I've been doing procedures on patients, and sometimes they're uncooperative during the procedure, and they don't understand. Sometimes the procedure is technically rather difficult. I'm trying to biopsy something smaller than a centimeter, that's way deep in their abdomen, and that could be challenging. So do what you can to help the doctor with the positioning for the procedure and how you cooperate for the procedure, because that can really increase the likelihood of a quick success with minimal risk of complications. Ask the doc too, will this treatment help me to live longer? Will it make a difference in my life? The point being is, a lot of things are done because those are the standard guidelines. And the standard guidelines might apply to a person who's unconscious, who's intoxicated, etc. But for a healthy walker-talker like yourself, if you're watching this video, you might not necessarily want that approach. What I'm saying is, the more informed you are, the more individualized your conversation and treatment will be, and that sometimes could be beneficial for you. Prepare before you go to the physician's office. Make a list of any questions you have. A lot of times people get there, they're a little nervous, they forget to ask the questions that they might have had. Keep a track of your medical history so you know it. Your lab results, like knowing your old cholesterols, your old renal function labs, they're helpful for comparison. If you had previous CAT scans or MRIs, having those on a CD is helpful. You're less likely to need to get stuff repeated. It can speed up your care. And I think you should be informed about your medical situation, because it's your life, it's your health. There's things in life you maybe don't need to know about, but there's things you really should know about, and your health is one of them. Nutrition obviously is a big one. If you do get admitted to the hospital, consider having food brought from home if that's allowed. Low fat, low sodium, plant-based food tends to improve blood flow. Anything you want to heal, any type of wound or injury, it always heals better with good blood flow. The famous person for that is, look at Ruth Heidrich, the famous marathoner triathlete in her 70s. She was riding her bike on the road, got hit by a car, big femur fracture, and no one thought she'd ever walk again. She's always eating tons of salads and greens and other plant foods, and she got better in a couple of months. And so I mention that simply that there are plenty of examples of incredible healing in people that have their act together for health optimally. You also want to minimize stress. Stress increases the hormones of cortisol and adrenaline, and in particular, the cortisol will decrease healing. So minimize stress and stress equivalents, which are sleep deprivation, caffeine, and whatnot. Then again, if somebody's already drinking a cup of coffee or two every day, I would probably just let them do what they routinely do, because they'll probably be happier with that. But there's plenty of other things. You don't need to have the TV on. If the room could be quiet, you can sleep better. The patient has to sleep in order to heal well. So, If there's other noises, quite often hospitals are quite noisy. Do what you can to make it quieter. Do what you can to lower the patient's stress levels. Maybe bring some music CDs from home instead of watching TV, which can often be stressful. You figure that out. But all I'm saying is these little tweaks can sometimes make a big difference to help yourself or someone you care about. That's it.